Hi, my name is Lindsay, and I am a third-year physical therapy student at Upstate Medical University. I will be presenting this lecture on healthy aging and providing you with some information on how older adults can improve their health and quality of life through physical activity. In this presentation, I will define healthy aging, discuss the factors that influence how we age, describe age-related changes seen in older adults, outline physical activity guidelines, discuss the benefits of physical activity, and finally, I will describe different types of exercises to help you achieve healthy aging. The World Health Organization defines healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. The pillars of healthy aging include promotion of physical, mental, and cognitive health, management of chronic conditions, prevention of injury, and facilitating social engagement. There are a few facts that are important to note in regards to aging. Fact number 1 is that when it comes to health, there is no typical older person. Biology is only loosely associated with a person's age. For example, some 80-year-olds have physical and mental capacities similar to many 20-year-olds, and other people experience declines in physical and mental capacities at much younger ages. Fact number 2 is that everybody can experience healthy aging. Being free of disease is not a requirement for healthy aging, seeing that many older adults have one or more health conditions that, when well controlled, have little influence on their well-being. Researchers have studied several factors that may influence how older adults are aging, including genetics, environment, and lifestyle. As we can see from this illustration, lifestyle is believed to have the greatest impact on aging. Sedentary time, such as sitting, increases with older age and is linked with increased mortality. Reduced sedentary time has cardiovascular, metabolic, and functional benefits for older adults. Scientific evidence suggests that people who exercise regularly not only live longer, but they live better. And being physically active or doing everyday activities that keep your body moving, such as gardening, walking the dog, taking the stairs instead of the elevator, can help you continue to do the things you enjoy and stay independent as you age. Frailty can occur at any age, but is often seen in older adults due to sedentary lifestyles. To know if you're aging well or at risk for frailty, let's take a look at these 5 characteristics. Number 1 is unintended weight loss. For example, if you've lost more than 10 pounds in the past year. Exhaustion is describing everything you do as effortful, even including light activity. Low physical activity. This can be described as going out into the community less than 3 times a week, or not engaging in physical activity for the sake of exercise. Number 4 includes slowness, which is described as your fast walking speed not being that much faster than your average walking speed. And number 5 is weakness, and this can be quantified as the inability to stand from a chair without using your arms 8 times within 30 seconds. If you identify yourself with 2 or more of these characteristics, you could be frail or at risk for frailty. Consequences of frailty include decreased movement, dependence with activity, increased vulnerability, higher rate of hospitalization, and premature mortality. For example, if you get sick and you're frail, you may not recover to the same extent as a non-frail person would. This picture illustrates that concept, with the stressor being an illness or an injury, as you can see, and people with severe frailty do not recover to the same extent. A sedentary lifestyle is the greatest contributor to frailty. Therefore, exercise is the key intervention for preventing frailty. Challenging exercise can improve strength, balance, quality of life, and functional independence. I will talk more in depth about important types of exercise later in this presentation. There are many changes that our bodies experience as we age. Of these changes includes a loss of skeletal muscle mass, also called sarcopenia. Most older adults lose 30 to 50% of skeletal muscle mass by the age of 80. And while this age-related loss of muscle mass is normal, older adults who do not engage in physical activity can lose muscle at a much greater rate. This can lead to a number of adverse outcomes, such as physical disability and poor quality of life. Sarcopenia is also linked to increased fall risk and fracture, frailty, movement disabilities, hospitalizations, poor health outcomes, and osteoporosis. The good news is that regular exercise combined with adequate protein intake can reduce this loss of muscle and improve quality of life. Around 30 to 40% of women and 20 to 40% of men over the age of 50 do not reach the recommended daily intake of protein. These protein deficits have adverse consequences, including impairment of muscular, skeletal, and immune function. New evidence shows that higher dietary protein ingestion is beneficial to support good health, promote recovery from illness, and maintain functionality in older adults. Older adults should consume an average daily intake in the range of 1 to 1.2 grams per kilogram of body weight per day. To give you guys an example of this, if you are 145 pounds, that is 65 kilograms, and you should be consuming between 65 and 78 grams of protein per day. It is also worth mentioning that protein intake should be spread equally throughout the day and around the time of exercise. Exercise has many benefits on physical and cognitive health that is essential for healthy aging. A few of these benefits include decreased risk of chronic diseases such as heart disease, colon cancer, and diabetes. It can also reduce blood pressure for people with hypertension. Exercise can decrease fall and fracture risk, improve joint motion, improve heart and lung function, and reduce fatigue. Exercise also has an impact on our mental and cognitive function by reducing feelings of anxiety or depression and improving memory and attention. The American College of Sports Medicine and the Center for Disease Control have created exercise guidelines for older adults to promote healthy aging. This recommendation includes at least 150 minutes of moderate intensity aerobic activity and 2 or more days of resistance training per week. I will discuss these guidelines more in depth when I discuss aerobic and strengthening activities. There are 4 types of exercise that can improve your health, physical abilities, and encourage healthy aging. While many people tend to focus on one type of exercise or activity, research shows that it is important to include all 4 types of exercise in your weekly routine because each one has unique benefits that are important for older adults. Additionally, doing one kind can improve your ability to do the other, and variety helps reduce boredom and risk of injury. Endurance activities, often referred to as aerobic, increase your breathing and heart rates. These activities help keep you healthy, improve your fitness, and help you perform tasks you need to do every day. Aerobic activities have numerous cardiovascular and musculoskeletal benefits for older adults. These benefits include improved heart health, circulatory system, and lungs. Aerobics can also delay or prevent many diseases associated with older age, such as diabetes, cancers, and heart disease. Examples of aerobic activities include walking, cycling, swimming, yard work, tennis, or dancing. The physical activity guidelines for older adults recommend a minimum of 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity per week. Moderate intensity includes brisk walking, water aerobics, ballroom dancing, and gardening. Vigorous intensity includes jogging or running, aerobic dancing, and heavy gardening. You should gradually increase your exercise to 30 minutes on most or all days of the week. If you don't have 30 minutes in your daily routine to be active, you can exercise in 3 10-minute periods per day. Strength training, also called resistance training, includes exercises that causes your muscles to work or hold against an applied force or weight. These exercises can make everyday tasks easier, such as getting up from a chair, climbing stairs, or carrying groceries. Keeping your muscles strong can also help with your balance and prevent falls and fall-related injuries. It also reduces muscle loss as we age, or sarcopenia, as we previously discussed. Strength exercises include exercises that utilize handheld or ankle weights, machine weights, elastic resistance bands, or uses one's body weight for activities such as stair climbing and squats. You can use resistance bands, lightweight objects around your house, or equipment at the gym to perform strength and resistance training. You should keep doing each movement 10 to 15 times, or one set, rest, and then repeat each movement for another 10 to 15 times. These exercises should be challenging. If your muscles are not fatigued after 15 repetitions, you may not be getting the full benefit of the exercise and you may want to increase the weight. Try to slowly work your way up to 2 or 3 sets of each exercise and do a variety of muscle strengthening activities at least 2 days a week. These 2 days should be non-consecutive to give your muscles adequate rest time, and they should include 8 to 10 exercises per session involving all the major muscle groups. Balance exercises improve your balance and reduce your chance of falling. Falls are common in older adults due to weakness and sedentary lifestyles. Balance exercises help prevent falls and serious related consequences. Many lower body strengthening exercises will also improve your balance. Examples of balance exercises include Tai Chi, yoga, standing with feet close together, standing on one leg, or heel-to-toe walking. You can start slowly and work your way up to doing balance exercises at least 3 days a week. Examples of balance exercises include holding onto a sturdy chair or wall, and then standing on one foot for 10 seconds, then repeating this 10 times. Next, switch to your other leg and repeat that for 10 times. Stretching can improve your flexibility, making everyday tasks easier, such as reaching the top shelf, trying to tie your shoes, or turning your head in your car. Examples of stretching exercises include reaching for your toes, lifting arms overhead, rotating your body with feet planted on the floor, and rotating your head. Stretching exercises should be done after aerobic or strength exercises. You should also focus on breathing during this time by taking deep breaths in your nose and out your mouth. Stretch slowly to reach the desired position without causing any pain, and then hold for 10 to 30 seconds. Relax, breathe, and then repeat, trying to stretch farther. Now that we have all that information on best exercise prescription and the importance of exercise for older adults, let's get moving. Any movement is better than no movement. If you're new to exercising, start slowly with activities that you feel comfortable doing. Walking, for example, is an excellent activity to start with. As you become more comfortable with exercising, slowly increase the time you exercise, then increase the difficulty of the activity. Make sure to wear loose clothing that's comfortable and well-fitting with sturdy shoes. And make sure to drink water throughout the exercise session. Exercising with others is a great way to stay connected, keep you accountable, and set daily goals. Grab a friend or find a group of people with similar interests as your own to make exercise something you look forward to every day. I hope that you have enjoyed this presentation on healthy aging and have gained some insight on the importance of physical activity with age. This was only a brief overview of many important topics. So if you would like more information on any specific topic, fill out the feedback form and give it to your office administrators, or you can reach me directly at smitlind@upstate.edu. Thanks again for your time.